why aren't all doctors open, at least to the idea of the low carbohydrate lifestyle? I mean, some are so vehemently against it. It's stunning.
That's how we're trained. We are trained that fat is bad and you need to avoid dietary fat. And you need your healthy whole grains and your healthy fruits and vegetables, and those have a health halo around them. And how can any diet that doesn't have those be, that doesn't emphasize those, be healthy? And that's how we're trained. So it's so hard to overcome that incorrect training, but then that just gets ingrained in our belief and our philosophy over decades of practice. And it's so hard to do. I think the other part is, though, like a lot of docs just don't have the time and energy for it. You know, they're overworked, overstressed, seeing too many patients without enough time. And how are you going to completely change the way your patient is eating and educate them in your 5 or 10 minutes that you have with them, when you have to go over their prescription list, where you have to type up their note, where you have to go, you have to check all these boxes for your group for your medical group to get paid properly? Like, that's where the focus is, rather than on the lifestyle changes. And a number of people are just jaded. You're like, I've tried so many times to get people to improve the way they eat and to get them to exercise, and it doesn't work. Why waste my time if it hasn't worked? Well, maybe it's part of the message. Maybe it's the message that's been wrong, and changing the message can help people with compliance and seeing results. A lifestyle that helps you see results quickly, you're much more likely to stick with than ones you don't see results with. So all those factors come into play. There's a lot there to unpack for sure.
Mm-hmm. And that's an interesting point you made, but also probably lifestyle that people can stick to. Yeah.
I mean, I can't tell you how many times patients come back for your 6-month follow-up. Oh, how are you doing with the diet and the exercise we talked about? No, hated it, couldn't do it. And like, all right, check. I tried, he failed. Here's your prescription, right? Like that. I'm embarrassed to admit it. I did that so many times, and it took a number of years for me to realize, wait a second, something's wrong here. This is not the way it's supposed to be.